What I'm going to do is give you a case scenario, and we're going to have some questions following. So, if you wouldn't mind listening. So, here we are working as an emergency department nurse. It's Friday evening, and you have Miss F. She's 27 years old. She's had diffuse abdominal pain over the last 12 hours. And as the pain worsens and vomiting develops, she goes to the local ED. And according to Miss F., her only significant past medical history includes ovarian cysts and asthma. Her current medications at home include an albuterol inhaler as needed. She also had a laparoscopic removal of a right ovarian cyst 5 years prior. Mrs. F informs you that the onset of pain has increased and became more severe over the past 12 hours. She's had some vomiting that started 6 hours ago, and she describes her vomit as bile in nature. She's taken no medications for her symptoms and has only used a heating pad to help relieve the pain in her abdomen. You instruct Miss F about not using a heating pad because she may have an appendicitis, and a heating pad increases the risk of perforation. Upon exam, Miss F rates her pain at 10 out of 10 on the pain scale throughout her abdomen, with tenderness and guarding noted on palpation. The patient also has positive psoas and obturator signs. She has hypoactive bowel sounds in all four quadrants, and Miss F is febrile with a temperature of 101 degrees Fahrenheit tympanically. Heart rate is 120 and regular, respirations are 24. Blood pressure is 168/52, and pulse ox is 98% room air. Lung sounds are clear to auscultation with a poor inspiratory effort noted. Peripheral venous access and labs are obtained. Now, after hearing this story, I have a few questions that I'd like you to answer in the discussion post for this week. So, number one, what do you think's going on with this patient? Number two, what workup do you anticipate for this patient? And number three, if the patient ended up having an acute appendicitis, what might her labs look like? What medications do you anticipate giving this patient? Finally, what are some immediate and ongoing interventions that you anticipate for this patient?